Many people come into a first session worried that they're going to be judged for what they're about to share. So I'm here to tell you what happens when you do a first session, and specifically what happens when you do a first session with NOCD. It's normal to feel nervous or weary when starting therapy. In fact, I have had a lot of people tell me that the fear of being judged by a therapist is part of what kept them from being able to start therapy for so long. So, whatever it is that you're feeling, I just want you to know that as a therapist, I have likely heard it all before. And part of my role, especially in that first session, is helping you feel comfortable and to be able to work through those emotions so that we can start taking steps towards achieving your goals. But before I keep going and tell you more about what happens in a first session, and again, especially a first session at NOCD, I'll first start by telling you a little bit more about myself. So hi, my name is Kayla. I've been a therapist for 6 years, and I've been with NOCD for the last 3 years. During that time, I have helped so many people face their fears and ultimately get their lives back from OCD. A little bit about NOCD. So we specialize in helping people with OCD access effective, affordable, and convenient treatment. We offer virtual exposure and response prevention therapy, which is the gold standard treatment for OCD. When you get started with NOCD therapy, you'll work with a licensed therapist like myself who specializes in OCD. As an OCD therapist, we really understand OCD, and we are not here to judge you, no matter what your thoughts are. So let's get back to talking about what happens in a first session. Part of our goal in the first session is that we want you to get to take time to feel comfortable. So you can rest assured that we are not going to immediately jump into talking about your OCD right at the beginning of the session. We'll definitely have some time to kind of settle into the session first and get to know each other. Right at the beginning, we will gather a little bit of information from you. We'll get your ID just to make sure that we're meeting with the right person. We'll get your address, and then we will go over all the paperwork that you filled out prior to this first session. I know that sometimes it can feel like a lot to fill out all those forms, but we want to definitely make sure we take time at the beginning of the session to go over everything you filled out and make sure we answer any questions that you might have about the informed consent or the privacy policy before we get started. At this point, my goal is to get to know you better. I want to know what pronouns you use, and I want to know if there's anything about you that feels really important for me to know before we get started. I will give you space to share about what is bringing you into NOCD today. You are welcome to share as much or as little as you feel comfortable with at this point, and I'll ask questions as we go to guide that conversation. Once we've talked generally about what's going on, I'll ask some more specific questions to really understand the problem that's bringing you in and make sure that we can leave that first session with a clear diagnosis for what's going on. That way you can feel really confident that you are on the right track for treatment. These questions are going to be along the lines of, how long have you had this problem? What types of thoughts or behaviors are going on for you? How distressing is this problem for you? What are the different ways that this problem is getting in the way in your life? And I want to say that I know this part can be really challenging for a lot of people because this is often where we're talking about the details of your OCD symptoms. I want to just reiterate, I am not here to judge you. I am very, very, very grateful that you have come in to share these thoughts with me. And this helps us make sure that we are getting you on the right path towards treatment. At this point, we're going to ask you some questions about safety and risk. These are standard risk assessment questions, asking about any thoughts that you've had or any intent that you've had to harm yourself or another person. This is so that we can make sure that we are the best level of care for you. And I know that this can be a part of the session that can be pretty anxiety provoking for a lot of people. So I did want to reiterate, you are working with a trained OCD professional, and we are trained to know the difference between intrusive thoughts about harm, which is really common with OCD, and actually having intent to harm yourself or another person. So this is a standard part of our first session here. And I want you to know that our goal, again, is to make you feel as comfortable as possible while asking questions that I know can be pretty anxiety inducing for a lot of people. At this point, we're going to work together to create something called a support plan. This is a document that's going to be saved in your app and in the online member portal. The goal of this is just so we can brainstorm some ways for you to cope in times of distress and also list out the people who can be a support to you when you're having a hard time. And finally, we are at the end of our session. So at this point, I've gotten a lot of really helpful information for you. And I'm going to share with you a little bit about the diagnosis that I'm making, as well as what I believe would be a helpful treatment plan for you. Assuming that we have determined that OCD is an appropriate diagnosis, I'll answer any questions that you have about that. And I'll also tell you more about ERP and what to expect from treatment. We'll talk a little bit about NOCD and some of our guidelines for what this process looks like. And again, biggest priority here is that I'm just answering any questions that you have about OCD, ERP, or what it looks like to do therapy with NOCD. We will talk about next steps. So we will talk about what the next few sessions are going to look like. We're going to schedule out our future sessions. And then I'm going to leave you with a message that I'm going to send you afterwards that just kind of wraps everything up. And also, I want to reinforce that at the end of our session, you are welcome to message me with any questions that you didn't get a chance to ask in our session. I hope this breakdown helps to ease any fears or concerns about getting started with therapy. If you or a loved one is struggling with OCD, head to NOCD.com to get started with treatment. Our team can pair you with a licensed therapist like me, and you can get started with treatment really soon.